Hello and welcome back to The Wellness Pharmacist. I'm your host, Dr. Kat. I'm a pharmacist in the United States, women's health educator, and advocate for evidence-based wellness. And today we're exploring the rapidly shifting landscape of women's health rights and digital privacy in this particular episode. So we're going to cover hot button topics today, which is the UK's move to decriminalize self-managed abortion outside of particular laws, the ongoing crisis of reproductive rights in the United States, and then the growing privacy concerns around period tracking apps, this FemTech apps. Let's start across the Atlantic in the UK, where lawmakers there have just taken a very bold step forward. Members of Parliament voted in favor of decriminalizing self-managed abortions in England and Wales. This is absolutely huge. This is monumental and fantastic. Right now, or before this, under the 1861 Offenses Against the Person Act, abortion could technically be punishable by life imprisonment. And that was in 2025. Life imprisonment. That's the Victorian era. That's a Victorian era law. And these women could be imprisoned for life. Let's dig deeper though. So women were being criminally prosecuted on suspicion, even suspicion of aborting or ending their own pregnancy under that particular law. And this was even before women had the right to vote. In the past year, and I looked this up on their bill and for reasons why they were doing this. So in the past year, apparently in England, 6 women alone have appeared in court, and they were charged with either ending or attempting to end their own pregnancy outside of these this particular abortion law. And in recent years, abortion providers have received 50 requests for women's medical records from the police in relation to these suspected aborted or abortion offenses. So now we're getting the police, we suspect. So Westminster voted to repeal the laws criminalizing women in Northern Ireland, in 2019. These laws, though, still remained in effect in England and Wales, even though Northern Ireland passed this in 2019 or 2020, something like that. So what happens now if, voting in favor of this change, it doesn't change the actual abortion time limits. It doesn't change the provision in any way. What it does is it's a question of whether women should be sent to prison, sent to jail for ending their own pregnancies outside of this current law. So the current law, again, abortion in England and Wales is still a criminal offense. It's still a criminal offense under the Offenses Against the Person Act of 1861 and the Infant Life Preservation Act of 1929. This one, the second one, criminalizes later abortion, so after that 24-week period. It's still a crime. It remains a crime that carries a life sentence if it's done outside these provisions. Okay. And even though Northern Ireland repealed these laws in 2019 or 2020, women accessing abortion in Great Britain do so under the current Abortion Act of 1967, which still has a time limit. So if you're past that time limit and so you still do it, then it could be life imprisonment. This law did not decriminalize abortion. Okay, it just makes it legal in certain fixed circumstances. Maybe I said that better. So under these laws, abortions must be signed off by 2 doctors. And then they, of course, have to take place in a hospital or a clinic that's approved by the Secretary of State for Health. And then these females must meet one of 7 criteria that allows for an abortion to take place. And any female who undergoes an abortion without the permission of 2 doctors. So we have now easier, I wouldn't say they're easy, but easier access to ordering pills online, mifepristone, mifepristone, abortifacients, and so that's how that would happen if you didn't have this 2 doctor permission. If you just ordered it online, this can be prosecuted still, and you can receive a life sentence here. Okay, because this takes place outside of those provisions of this act. So women who seek to end their pregnancies outside of the current laws, this 1861 law, 1929 law, it's almost 100 years. Generally, you're looking at really desperate situations. You're looking at females in situations that they see this as their only way out. They can't afford to eat themselves, or they can't afford to take care of their own children. So these are desperate females. We know that according to certain sites that these females are already mothers. So again, they're trying to feed their own children, and then they find themselves pregnant again. So desperate times. In these situations, these females deserve our compassion, and they deserve good quality care. They don't deserve punishment. That's the basis for this lobby for this bill. Other females have been investigated after experiencing stillbirth. Wow. Stillbirth, that's so difficult because you've gotten to a point where the fetus is viable, and these females deserve our compassion. These females are going through a horrific, distressing situation. They're already under a tremendous amount of stress. Their bodies are still bleeding. Yep, bleeding. Let's go there. So you have this extremely stressful event, and then they're being investigated to see, oh, did you abort? I mean, really? The first thing should be, is this person okay? I'm not saying that you can't have an investigation, but this is not what's happening. We're just accusing these females and going straight to the punishment and not considering the situation. So examples were given. Let's see. 7 police officers arrived at the home of a woman who called an ambulance when her baby was born prematurely at home. So instead of assisting her and helping her while she performed mouth-to-mouth on her unconscious child, and this infant was still attached to her placenta by an umbilical cord. She was performing the mouth-to-mouth. The police officers, were searching her garbage cans, her bins. Provided no assistance to her. The good news, the mother and the baby survived. But what if they hadn't? What if they hadn't? What if the baby hadn't? What if the mother was bleeding out too, by the way? Then there's another instance where a 17-year-old girl, I say girl because around the world, 18 is generally where you're an adult. I know in other places, people 16, but you're really not an adult at that point. So we're going to say 17-year-old girl presented to an abortion clinic in the early days of the pandemic. And of course, everything gets shut down, right? So you can see where this is going. Unable to travel to the clinic on 2 occasions because of the COVID lockdowns and those restrictions that were passed, she passed the legal time limits and was referred to children's services and antenatal care, right? So you have to have the child. However, soon after, she delivered a stillborn baby at home. And instead of getting, mental health treatment, physical treatment, she was investigated by the police on suspicion of abortion. And those, that carries a life sentence. So in this instance, stillbirths can happen sometimes when maybe she was incredibly stressed out and her body just aborted the child. Maybe the umbilical cord was wrapped around the baby's neck and it died. And I mean, there's a number of different reasons for this. And this is all to say that stillbirth is not due to anything that the female did. It just happens. Just like miscarriage. It just happens. And these females should not be punished for this. These females should be gotten to a counselor, get mental health care, get some support. They're going through a horrific experience. Can't stress that enough. So, another instance, there was a female taken to the hospital by an ambulance, owing to complications from early medical abortion medication she was given after a medical consultation that year. Okay, so in this instance, she thought she was 10 weeks pregnant. She wasn't. She was really 19 weeks pregnant. And though in England and Wales and the UK, it's up to 24 weeks. So she was still within that legal limit of abortion. She was discharged from the hospital. So this is like early morning hours, apparently. Returned home to find police there, and they were searching her property. That's not what you need to see when you're, especially the wee small hours of the morning. It's a traumatic experience regardless of what happened, and she needs rest, nurturing, and instead she finds police there searching her property. The impact is profound. The proposed changes would have no impact on this provision of abortion care, right? So you have laws that govern the doctors, nurses, and midwives. So there would be no change to the 24-week. There's a 24-week, like I said, time limit. And there are circumstances after this 24-week you can petition and get an abortion if it's, threat to the mother, things like that. So exceptional circumstances beyond that, but you have to petition. So it's up to 24 weeks. There's no change to this 10-week telemedicine limit that was agreed by Parliament in 2022, that recent, okay? Abortions would still require 2 doctors' signatures to be legal. Women would still have to meet on like the hospital grounds or a clinic that is laid out in the Abortion Act of 1967. That does not change. It stays the same. Non-consensual abortion would remain a crime at any gestation, so life imprisonment. Those experiencing domestic violence or violence of any kind against the women and girls would, these females would no longer face prison time for having an abortion. That's great. That's a great step forward. And anybody with a medical license, so they're a practicing medical professional who assisted a woman in obtaining an abortion outside these now current laws, would be liable for prosecution. As it stands right now, England and Wales has the most severe penalty for illegal abortions in the world, which is surprising to me when I read that. I didn't know that. You've got a maximum life sentence in prison. There are obviously other countries with very strict laws, but they're less strict than England and Wales. Again, it was just surprising. So those include Afghanistan. So a pregnant woman in Afghanistan, if she has an abortion, results in short imprisonment or shall be fined. In South Sudan, a female who has an abortion gets an imprisonment term for no more than 7 years and a fine. In Syria, you've got 6 months to 3 years. Then we go to the United States, which I will talk about. We have Texas, and it's a near total abortion ban from 6 weeks on. The law specifically states, quote, "This chapter may not be construed to authorize the imposition of criminal, civil, or administrative liability or penalties on a pregnant female on whom an abortion is performed, induced, or attempted," end quote. All this to say, the female is not prosecuted. Okay? The female is not. But in England and Wales before this, they were. So around the globe, nearly 50 countries do not criminalize women who seek to end their pregnancies outside of the law. And the most consequential ones, that really stick out for me are Northern Ireland, France, Republic of Ireland, Australia, Canada, and New Zealand. And even with countries that have strong anti-abortion laws, most of them don't criminalize the women under these strict abortion laws. And that includes the United States and Poland, by the way. In 2016, Trump indicated he wished to see women criminalized. There was a big pushback, even with anti-abortion organizations across the U.S., saying no, this is the punishment is solely for the doctor or the prescriber, right? The one that gives the pills are the ones that perform the action, not the female. So back to the UK, those Victorian era laws, which criminalized females 161 years old. Some parts of it date back to 1623. Whoa, guys, we've come a long way since 1623. We've come a long way since the 1800s. And of course, they don't reflect society today. They didn't have vaccines back then. And that's sound and should be given everywhere. Vaccines are safe. They're effective. They've saved millions of lives over decades of time, and they're important. And we've evolved, so our laws should evolve as well. And we're talking about desperate women, right? Desperate women, and society needs to reflect that. So for every woman who ends up in court, according to this legislation bill, 10 are subjected to prolonged police investigations. And this prevents them from getting mental health support that they're absolutely in desperate need of, and has resulted even in existing children of these females being separated from their mothers. And some of which, the cases never make it to court, and they're permanently separated from their mothers. This isn't good. This isn't good for children either. This is mentally scarring for life, and it does. It leaves a horrible mental impact, and this could continue on. Other things can happen to these children. This is just awful. So women deserve better, and that's what we're advocating for. That's what we're calling for. And that's what this bill was. It was women to be removed from the Offenses Against the Person Act of 1861 and the Infant Life Preservation Act of 1929 in England and Wales. So you can look up those bills in bills.parliament.uk. I got some information from Reuters. The proposed reform seeks to remove these criminal penalties for women who induce abortion outside this current medical framework. It means safer access, less stigma, reduced risk of prosecution, especially for the most vulnerable populations. We're talking, again, victims of domestic violence, immigrants, and those living in rural communities. And as of this recording, I am thrilled to announce that 379 lawmakers voted in favor yesterday of changes to these antiquated laws versus 137 opposed. It has passed. The Victorian era law has been repealed, and this is a fantastic step forward for women in this globe right now where everything seems to be on fire. This is a wonderful time to stop and just relish in this moment and just feel that relief. There are a lot of people, I'm sure, that lobbied for this. And for those of you that did, I thank you. I really do. We need to take time to just kind of sit and recognize the importance of this moment. Legally, it affirms bodily autonomy as a human right, male or female. Obviously, this is just a female thing, but I believe in bodily autonomy. I don't care if you're male or female. Medically, it could open the door to potentially expanded telemedicine for early abortions. We're not talking past the 24-week. Nobody's messing with that. Personally, honestly, it tells women they won't be treated like criminals for making healthcare choices. This is a healthcare situation between a doctor and the female. Period. End of report. Meanwhile, across the pond, the United States is devolving, in my opinion, is experiencing a very different shift. Since the overturning of Roe v. Wade in 2022, More than 20 states have implemented partial or near total abortion bans. And in some states, miscarriage management is now under scrutiny. Some even going as far as proposing women report to law enforcement that they've had a miscarriage. I mean, that is not on my list of things to do. There are a lot of miscarriages. There are many females out there that have had miscarriages and you don't know it. And there are many out there that have miscarriages. And the first thing that you think of isn't, oh, hey, let me call my local police department and tell them that I've had a miscarriage. That's private information. That's ridiculous. If it's a miscarriage, why are we reporting it? Well, you can report it to your doctor, but that's where it needs to stop. Otherwise, it's an invasion of privacy and it causes undue harm and it causes duress. This brings on mental health issues that will last for decades to years, generational traumas. And guys, that's a very real thing. That's a topic for another day. Even pharmacists face legal ambiguities, this legal gray area when dispensing these abortifacients. So you have misoprostol and mifepristone, and they basically banned one, and they're going for the second one. And these abortifacients, they're not just used as abortifacients. They're used in after different gynecological reasons that don't relate to abortion. So we really do need them to preserve the life and integrity of the female reproductive tract for women to continue to be fertile, for the women and the females that really want to have children in the future. These are important. They're very important, and yet we're taking them away, But hey, they say, hey, we're trying to protect lives. We're trying to protect the female's life and the child's life. I haven't seen that. I see women and females dying. Children are already dead anyway. If there's no fetal heartbeat and you're saying no, these doctors are too scared to perform these procedures because they don't want to lose their hard-earned license and be thrown in prison and fined in the United States. Women are dying of sepsis. That's a horrible way to go too, by the way. And even if you survive it, chances are you'll be sterile. You can't have children anymore. And these are females that really wanted these children, and these things happen to them. This is ridiculous. So let's dig deeper into the U.S. Abortion banned states. There are 12 as of right now. We have Idaho, South Dakota, I'm calling you out, Texas, Oklahoma, Arkansas, Louisiana, Mississippi, Alabama, Tennessee, Kentucky, Indiana, West Virginia. Gestational limit between 6 and 12 weeks from last menstrual period. Okay, we have 6 states. So that's 6 to 12 weeks. So 12 states, abortion is banned. And I just listed those. Okay. And then we have 6 to 12 weeks of last menstrual period. 12 weeks being 3 months along. We have Nebraska, Iowa, North Carolina, South Carolina, Georgia, and Florida. Then we have 4 states that have 18 and 22 weeks from last menstrual period. We have Utah, Kansas, Wisconsin, and Ohio. And then we have 19 states, gestational limit at or near viability. Washington, California, Nevada, Arizona, Montana, Wyoming, North Dakota, Michigan, Illinois, Vermont. No, Vermont is with no gestational limits. We have PA, so Pennsylvania, New York, Maine, New Hampshire, Massachusetts, Connecticut, Delaware, Hawaii, and Rhode Island. No gestational limits. There's 9 states plus DC. So plus DC. So these 9 states are Alabama, Oregon, Colorado, New Mexico, Minnesota, Michigan, Maryland, New Jersey, and Vermont. And then you have DC. There's the list of them. In some states, there are criminal penalties for physicians. And this data is current as February 2025. Maximum prison sentences we have, which is life prison sentence, so 5 to 99 years, is in Texas. We have 10 years to life in Michigan. In Tennessee, we have 3 to 15 years in prison. In Mississippi and Arkansas, not to exceed 10 years. In West Virginia, 3 to 10 years, but not for physicians. In Oklahoma and Idaho, we have 2 to 5 years. Kentucky, 1 to 5 years. Indiana, 1 to 6 years. And then South Dakota, 2 years, not to exceed 2 years. Also, this is grounds for medical license revocation. So this means taking away their license. And let's think about that. So if a physician's license is revoked, even after they've served their sentence, they may not return to practicing medicine. And this is years and years and years of education and money spent on this. And just, we need physicians. License revocation penalizes and jeopardizes physicians' livelihoods, but it also jeopardizes people's lives, male and female. And in many states, license revocation in a different state is grounds for denying it in the new state. Okay? Or revoking an existing license in that state if they have it in multiple states. And while there are states that will, offer a physician a license if it's been revoked solely based on this abortion provision, right? It's a gamble. You don't know. You really don't. And this could be taken away at any time. So in these circumstances, there's no certainty that this physician would be able to receive a license in another state. And even if they did, they'd have to move to another state. So these females are getting less care in that one state. They'd still have to move. This is expensive. It's a deterrent to physicians wanting to keep all of those years of education and money spent intact, which is exactly the point, isn't it? We always say here, in the United States, it was always states' rights, except it wasn't states' rights, because when the particular person that's in charge right now, it was states' rights until it's not. It was always about getting elected. This is made into a political issue, and it shouldn't be, because it's not political. It's healthcare. This is not a political issue. If you don't want an abortion, don't get one. Why are you forcing your opinions on somebody else? That is not body autonomy. If you don't want a vaccine, you have the right not to take it. But those that want the vaccine should have a right to take a vaccine. This is about body autonomy. This is all political. And the United States actually was built on a separation of church and state. And people would argue that, but there's nowhere in the Constitution does it say church and state together should rule. That's not the case. It's just not there. You can read it. I've read the Constitution. I've read the Bill of Rights multiple times. So, of course, the sentiment on the right is that life is being protected, but is it really? If females do not have a body autonomy, we end up with a female on life support who was legally brain dead in a particular state in order to incubate a child. The female becomes a thing, becomes like this object. And if this really were about life, then why aren't there stronger laws for rape, incest, sexual assault? Because there aren't. Why are the children's programs to feed children breakfast, lunches at schools and centers being taken away? Why is healthcare being taken away? Why is healthcare being taken away from veterans, military veterans? That's another story entirely too. If we really cared about people, we wouldn't be doing this. Because if this was really about this supposed child, then these and a whole host of other programs would be funded and these laws enforced. Instead, they're not. Females have paid with their emotional health. They paid with their physical well-being for centuries. And it doesn't appear to be ending anytime soon in the United States. Now, women have been paying with their emotional, physical well-being for thousands of years. But we're talking about the United States, so that's why I said centuries. In fact, some would say it's devolving in the United States. I would agree with that. Females are dying due to sepsis, even when there's no fetal heartbeat. Like I've mentioned, females are being forced to carry children even for rape and incest. There are people in the government systems that keep getting voted in, and I don't know why, but they do, and that say that women can just think themselves, and not get pregnant. You just think really hard. That, guys, go back. I mean, we're clearly not educating biology, basic biology, in K through 12 anymore? We aren't? We haven't? Because that is just not true. It's not scientific, and it's not scientifically backed. And that's what we do here. You've got to have science. It's got to back it up. We haven't learned from history. Maybe we need a her story, right? Legally, we're seeing this patchwork system where access depends on your zip code and money to get to said zip code. So let's say it's privilege. If you have the money and you can go, although there are laws now in the United States that they're trying to be passed, that if you, and have been, that if you go to another state and get an abortion, that if there's tattletale laws, basically, for lack of a better way to put it, that if somebody finds out and they report it to that particular state's government, that their prosecutions can happen. So you're not even safe if you go to a different state, which, again, that's not states' rights, right? So, I mean, if you go to a state that it's allowed, and California or New York or someplace like that, and then you go back to the state that it's not allowed, if it's really states' rights, it didn't happen in your state, so you have no jurisdiction. They're basically claiming that they claim you wherever you go, and that's just not true. Not in the United States. Medically, it endangers people, especially those with what about ectopic pregnancies or incomplete miscarriages? And these females are dying. And this is not on them. These things happen, and they have happened. These kill. Personally, women are afraid, and they're afraid to seek help, and that's terrifying, and it's unnecessary, and it's the point. The point isn't about the children. The point is about control. This divergence from the UK and the United States highlights this global tug of war over reproductive rights, and it forces us to ask, who controls women's health decisions? Call me crazy, but if it's the female body, then the female should have body autonomy. Now let's turn to FemTech. So let's talk about data. Digital health apps, which are extremely popular, these, especially those focused on menstruation, fertility, have exploded in popularity. And many of them, though, collect incredibly sensitive health data. And so in the United States, there's HIPAA, which is the Health Information Protection Act. And often this health data is shared with advertisers, third parties, and now apparently in some cases law enforcement. So huge red flags here. A new report out of Cambridge this week warns that period tracking apps can be weaponized against users in countries where abortion is criminalized. And they're warning these females off of it, saying, hey, be careful. Some apps collect location data, sexual activity, and symptoms. And unfortunately, users rarely read the fine print. I highly recommend you read the fine print. And, you know, we can track this stuff on a regular pad of paper too, guys. Not on your computer. So should FemTech be regulated like medical devices or like HIPAA covered tools, those sorts of things? I believe so. I believe they should. These apps are not games. They can be used in legal investigations, reproductive surveillance, and health discrimination. Women deserve digital safety. Females deserve digital safety and freedom. There is a push for public health governed alternatives, nonprofit apps that prioritize user consent, transparency, and offer encryption. Until then, again, please check your app's privacy policy. If it's free, you are likely the product here. And that opens you up to could potentially a world of hurt and even, I'm sorry to say, death. It's not to scare anybody, but we've got to be careful in this digital age. So I would just advocate for yourself there. I want to take that extra step of precaution. And if you need to, just write it down in a good old-fashioned notebook. As women navigate this ever-changing healthcare landscape, the systems and technologies, one thing does remain clear. Autonomy is non-negotiable. Autonomy is non-negotiable. Whether we're talking about abortion access or data privacy, the common thread here is trust and the ability to make informed, safe choices for ourselves. Again, body autonomy. If you found today's episode helpful, please share it. Please share it with someone who needs to hear it. Subscribe, please, on your favorite podcast app. Visit me on my website, which I'll link in the notes. It's innovationsmedicationmanagement.com. For more resources and upcoming courses, I have a fatigue fix. If anyone out there, the women, especially with autoimmune disease, if you are struggling with fatigue, I do have that available. And if you have something you'd like featured, a topic, please send me an email via the website. There I have a contact section. And who knows, it may end up as an episode. Until next time, please stay well, stay strong, stay informed, and keep asking questions. Until next time, have a great one, guys. And thanks so much for listening. We'll talk soon.